Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we're talking about our interview with Shandon Fowler, who is the founder of Four8 Insights. And to say that I'm mind blown is unbelievable. I mean, first of all, we know that I love talking about health plans and insurance. Second of all, we know that I love high deductible plans and decision support and all that kind of stuff. And that was everything Shan was talking about. He talked a lot about his expertise in policy in the ACA. So he brought a lot of information to this about the first Biden OE, what we can look forward to, what the special enrollment period has looked like over the last year on the exchanges because of the pandemic, with 12 million people enrolling during that. And now expecting even more during, not even more than the 12 million, but expecting another surge during the upcoming Biden OE. And so aside from actually talking about the plans themselves and what to expect, and then how this could potentially impact employer insurance in the future, he talked a lot about, near the end of the interview, actually, about what it's like experiencing this as a consumer on the exchanges, because he's obviously had employer coverage for many years, but he's now been on the exchange for several years. So he talked to us about the evolution and considerations that people need to do. Biggest takeaway from that: get out your pencil and paper and don't be terrified by the very high deductibles that you'll see. Apoorv, what stuck out to you?
Yeah, so exciting, Stephanie. I'm starting to, catch your enthusiasm over here with all the, a few. We haven't done a lot, but we've done a few of these types of programs. I think we should do more of them. Shan did such a wonderful job of explaining everything. What really struck me, again, not being from that area, what struck me is that it's paradoxical that the pandemic may have helped to stabilize the Affordable Care Act marketplace because there's so many people that suddenly lost their jobs, and through various subsidies, they were then able to get health insurance through the marketplace, which has just really been tremendous. I mean, he was describing small pieces of information that maybe our consumers don't even know. That, for example, even if you had as little as a week where you were without employment, you might qualify for a basic silver plan through the marketplace. So that's really tremendous. And there's apparently a lot of different subsidies out there. And so people talk about the cost of the plans and how expensive they are, but they don't emphasize that to the individual purchaser, depending on the subsidy, it may actually be as little as $50 a month that they're getting for a plan that can support them and their family. So very, very positive sides of the story, including the idea that the safety net may actually be stabilizing. I love that thought process. We also touched on aspects related to physicians, because being a physician myself and working with a lot of physician colleagues in my consulting work, we don't often hear about the impact of physicians and what they're thinking about when they're seeing a marketplace patient. It's probably because they're not really differentiated in any particular way. They just have health insurance, which is amazing. So there's no particular stigma to the patient. They're still the same coverage, the same access that they would like to a provider. So that, I think, was very interesting and reassuring. And then I think he really brought it home when he talked about not only, the high deductibles, but then you got to do the math and make sure that it really works for you. But when you really get down into it, you've got to be careful when you think about it. It's a very personal decision. It's about your health. You have to think about your health. You have to think about how you consume your health. You got to be thinking about issues like vaccine and not vaccine. So it's a very careful thought process that each person has to go through and make it a very personalized approach, rather than simply I got to go buy, a car, from the dealer. So a really tremendous jam-packed informational interview. I'm so glad that we had a chance to speak with him.
Me too. I'm so excited to share this interview with all of you, because it really is enlightening no matter who you are. Unless you're as well-versed as Shan in the exchanges, you're definitely going to take several things away from the interview, because it was amazing. And he told everything from soup to nuts. So I'm really excited to share it with you guys, and we'll talk to you soon. Bye-bye.
Bye-bye.